Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on, Naples? Today, I have a very special guest on the podcast. I'm very excited. His name is Gary Reinl. He's known as the anti-ice guy. He's quite infamous, actually. So, Gary, how are you doing today?
I'm doing fantastic. How are you doing?
I'm doing excellent. Gary has been in the sports medicine field for, going over 40 years now. You've written, I think, 3 books. You pioneered the Mark Pro. Those are just some of the few of the accolades. Any other big key points I'm missing there, Gary?
I think that I've gotten old over the years. So been doing this since 1973. So
yep, since before I was born.
It's been a while.
So I think it was 2013. I saw that video you did on YouTube with Kelly Starrett. Was that 2013?
I believe so, yes.
Yep. And you really painted the picture of how we kind of have this ice thing wrong, which I really want to dig into. But just so you know, I've sent that video to so many of my patients because I tell all my patients a lot of times to not ice, and they look at me like I'm crazy. So I send them that, and that's very helpful. So first of all, thank you for that. But I kind of wanted to first start off with, if you don't mind, the story behind how ice came to be a thing in the rehab process. Because you put that in your book. I thought it was very interesting. Would you mind talking to that?
Yeah, happy to do it. So what happened in the early medical use, I don't really know, and I don't believe anybody knows. Mm-hmm. There's claims. Well, the problem with that is, where did they get ice from hundreds of years ago? So it's like, well, I'm not quite sure that's true. And clearly it couldn't have been true any place that was hot. Mm-hmm. So the chances of people using ice for hundreds of years is probably not true. Maybe a few people who trapped in the lost in the woods and sprained their ankle put ice on it, but you can't really find any valid. I have not been able to find any valid explanation of how that happened. Mm-hmm. And then I have a spot in time in 1978. Someone made up the Rice protocol. Physician by the name of Dr. Gabe Merkin made up the Rice protocol: rest, ice, compression, elevation. And that became very popular very quickly, actually. And then just at that time, sports medicine was starting to take shape. And as that was happening, that was something that people could do on the sidelines of sports. Mm-hmm. They could put ice on it. And then some genius invented a way to snap a little purple thing, and it became cold. So you could carry a ice pack in your pocketbook or in your backpack. And it was like, well, is this right to do? Where'd this come from? Well, where it comes from, I traced it back, and it came from 1962, a young boy named Everett Knowles. He was 12 years old, hopped a freight train in Somerville, Massachusetts. And when he celebrated his accomplishment of hopping on the freight train and riding it, by the way, you're not allowed to do that. You shouldn't do that. But kids in those parts of the country, basically everyone does it at some point. It's like the rite of passage. Once you get enough courage to jump on the freight train, ride it, and jump off, then that's a cool thing. Well, unfortunately for him, he put his arm up and cheered for himself and hit a stone abutment and ripped his arm right off. Oh. And with that, he fell to the ground and thought he had broken his arm. Actually, it was torn off. It was in his jacket, so he picked his arm up in his jacket and walked up the hill towards a factory. And some fellas noticed him and came over and realized he was having a problem and got him over to Mass General. And at Mass General, a doc there made a decision that changed the history of sports medicine. And what happened was the doc said, hey, we got a perfectly intact arm and a perfectly healthy 12-year-old. Let's put this thing back on. And with that, putting it back on wasn't as simple as it might sound today, because it hadn't been done before. And they had to assemble the team to do it. So there weren't telephones, pocket telephones that we have now, iPhones and things like that. There weren't really fax machines, and you had to go get the people. So they went out and got the doctors who they needed to put this arm back on. So an orthopedic surgeon, a neuro person, someone else who understood this about tissue and whatever. They had to get them all to the operating room. And the doctor gave the order that changed the history of sports medicine, really of medicine. He said, while we're getting this figured out, put that arm on ice.
Mm-hmm.
So what happened was, you say, well, why would you put the arm on ice? Well, the same reason that fish are on ice in the fish market, because when it's not attached to the body anymore, when it's not living, when there isn't circulation, it will begin to rot. So putting that arm on ice made sense. Now, with that, they attached the arm, and it was very successful. The blood returned, the hand turned pink, and they realized that, in fact, hey, this worked. Now, with that, every time the young boy did anything, basically when he left the hospital and he waved, it made international news. When he caught his first baseball, it made international news. And for years, they followed this young man. Mm-hmm. And it became a legend story that took the doctor all over the world to explain what they had done. In other words, how they had reattached the severed body part and what they did. And with that, in the past, remember, all you did was threw the body part away and tried to avoid bleeding to death. I mean, that's basically all you did. There was no sewing it back on before that. It's just, it was off. Well, now people are beginning to ask, the reporters are beginning to ask the doctors, hey, if this happens, what do we need to do? What do we need to know? And with that, the doctor, and I wasn't able to find out who said it first. I really tried to go back in history to find the old news reports and anything I could get that was still available online. And I couldn't find out which doctor said it first. But roughly they said this. When they're asked, what do I do if this happens? Don't panic. Remain calm. Mm-hmm. That became rest.
I see.
Keep the area cool. Keep it out of the sun. Keep the body part out of the sun. Keep it cool. That became ice. Use a tourniquet to prevent a bleed out. That became compression. And keep the intact part above the heart, if possible. And that became elevation. So the rest, ice, compression, elevation has nothing to do whatsoever with managing damaged tissue. It has to do with preserving a severed body part and preventing a bleed out. It completely is misrepresented in the literature. Completely, I mean, not even close. It completely missed. Because as the public began to shift to that sports medicine model in the early 80s, remember 78, Dr. Merkin made up the Rice protocol. By the mid 80s, sports medicine centers were popping up around the country. And people were now having athletic trainers and others on the sidelines of sporting events. Today, basically every sporting event has an athletic trainer, a physical therapist, often a doc on the sidelines. A medical doctor on the sidelines. And you say, well, this is just amazing. So this is a misunderstood application of a protocol that has to do with preserving a severed body part and preventing a bleed out? Well, the answer is yes. It's a completely misunderstood. In fact, it's completely wrong. And in fact, if you were going to make up about the worst way you could possibly manage damaged tissue, say a sprained ankle, a rolled ankle, if you said, what's the worst thing I could do to make this not heal? I would tell you to sit still with a bag of ice wrapped tightly around it while sticking up in the air. In other words, I would tell you to do the Rice protocol. If I was trying to get you to do the worst possible thing you could do, and you say, well, no, why would you say it's the worst thing? Well, think about it. You're going to sit still. That's going to slow down vascular and lymphatic flow. You're going to make it cold. That's going to further slow down vascular and lymphatic flow. Then you're going to compress it. That's going to further slow down vascular and lymphatic flow. And then you're going to elevate. At the very least, it's going to limit it in one direction. Now, does it help in the other? Uh, Not lymphatic flow. By sticking your arm up in the air does not improve lymphatic flow. The lymphatic system is a passive system, nearly fully reliant upon muscle activation around the vessels. Sticking it up in the air is not going to facilitate the movement of waste through the passive lymphatic system. So at the very least, it slows it down in one direction. Well, here's the problem with that. When you slow it down in that direction, that's the repair and cleanup crew trying to get to the damaged site. So are you sure you want to slow down vascular lymphatic flow in both directions, basically, for any prolonged period of time? What that does is actually traps the waste in and around the damaged site and prevents the natural flow of oxygen and supplies. Now, I challenge you to go in any textbook you can find of anything you've ever learned, call every professor you ever had and anybody who was ever a mentor or whatever to you. Call everybody and say, do you think it'd be a good idea to trap the waste in and around the damaged site and prevent the natural flow of oxygen and supplies?
Right. That's completely backwards. One of the distinctions I love you made in your book is the difference between inflammation and swelling, because I think people lump those two things together. So can you kind of define those two things?
And they do. Well, actually, it's likely the biggest mistake made in the whole management of this process. When you say, what's the single thing that's most misunderstood? It's that people say, oh, I got to get the swelling out. Got to keep the inflammation down. Well, stop. They're two different things. Inflammation is phase one of a three-phase healing process. It's inflammation, repair, remodel. Inflammation is a good thing, not a bad thing. You say, oh, we don't want too much. Well, it's just stop. Don't run away with information sometimes. There's not too much inflammation on every person every time they're injured, musculoskeletal injury. It's not possible that every time there's too much. Maybe sometimes there's not enough. Maybe it's just right. But let me ask a big question to you. You're a clinician, you have all the education you have. If you believe there was too much inflammation, if you believe that, how much too much is there? Is there 7% too much, 41% too much, 99% too much? Is there not enough? Are right hands different than left hands? Are you different than me? How are you determining that there's too much? How?
Right. It seems arbitrary.
Okay, wait, we have a problem then, because how are you going to restrict it then? If you don't know how much too much there is, and maybe there's not even enough, so maybe you actually need more. So we've got to rely on our innate intelligence or immune system to regulate this. And don't step back and say, well, I don't know whether my immune system knows what to do. Your immune system knows where your eyelashes and your fingernails goes, okay? The fingernails don't often grow out of the side of your elbow, okay? That's not what happens. Your immune system is in charge. It knows how to do this. It's doing thousands of things every second in your body. It can manage this. And to believe that the immune system would improperly manage the inflammatory response to a musculoskeletal injury, you can't find that in the literature anywhere. And I've looked, it's not there. There's no such claim made. Now, there may be people who have a dysfunctional immune system and something might go wrong. Okay, that's fine. But that's not every time with everybody. In fact, it's almost never. And I can prove that to you. If you were to go over to an area in Los Angeles, California, called Skid Row, if you went over there, you would find that there are people who are living very difficult lives. They're often on drugs, very frequently are chain smokers. They have poor diets. They don't exercise. Their mental state is questionable. And if they were to roll their ankle, if they were to fall off the curb and roll their ankle, they will ultimately heal. Now, so think about that. They have a terrible diet. They're often on drugs. They're chain smokers very often. They don't exercise. They have a bad attitude, and they have a horrible living environment. And yet their immune system will still repair their ankle. So let's not blame the immune system for not knowing what it's doing without thinking about it. The immune system is very well designed and it works. Now, that's the inflammatory response. That's inflammation. Remember, there's 3 steps in your process: inflammation, repair, and remodel. Every clinical textbook states that. That's not an opinion. That's a simple established fact.
Mm-hmm.
In fact, one of the leaders in the field says there can be inflammation, Ledbetter's his name, there can be inflammation without healing, but never healing without inflammation. So you need the inflammatory response. Now, swelling, on the other hand, that's something entirely different. Swelling is not a good or a bad thing. It is merely the accumulation of waste at the end of the inflammatory cycle that you have not yet evacuated. Now, I'm going to say that again because I want everybody to really get this, because it matters a great deal. Swelling is not a good or a bad thing. It is merely the accumulation of waste at the end of the inflammatory cycle that you have not yet evacuated. So you say, well, wait a minute. What? Don't I want to limit swelling? Not on the front end. In other words, the fluid is coming into the area on purpose. Mm-hmm. That's your immune system's response. It's what's transporting the repair and cleanup crew and preparing the waste for evacuation. So you might say, well, yeah, but you don't want too much. Again, stop. How much is too much? Is there 20% too much, 16% too much, 91% too much? You have more than me, or right hand different than left hands. What do you mean there's too much swelling? Well, first of all, there's not too much swelling. Again, almost never. The immune system is regulating this. We're perfectly fine. And if you remember in your textbook, they taught you that when you get hurt and there's damage, the damaged vessels constrict, convert ingredients in the blood, grow a clot, repair the damage, dissolve the clot, and normalize flow in 3 to 10 days or so, and the healthy vessels dilate and increase perfusion. In other words, the fluid is coming on purpose. Mm-hmm. It's mobilizing the repair and cleanup crew. So the fluid's supposed to come. You're not supposed to try to block it. It's a good thing, not a bad thing, but it isn't like I want swelling or I don't want swelling. I realized the way I just said that I didn't like that. It's not a good or a bad thing. It's merely the accumulation of waste at the end of the inflammatory cycle that you have not yet evacuated. That's all it is. Mm-hmm. It's not good or bad. It's just there. And it's there because you failed to evacuate it, not because too much came. There isn't too much coming. There's too little leaving. So then the big question would be, well, what causes it to leave? How does it leave? Well, it can only leave one way, and that's via the passive lymphatic system. And the passive lymphatic system is exactly like it sounds. It's passive. So in order to move waste through the passive lymphatic system, you have to activate the muscles in and around those vessels. And what happens is the muscle contracts around the passive lymphatic vessel, pushes the waste up a chamber. That empty chamber now has negative pressure that pulls waste out of the interstitial space, and so on. So it's like, in my visual, it's like milking a cow backwards. Yep. And it's like, oh, so that's how it evacuates. Okay, so that's how it evacuates. And why do I want to evacuate it? Because if you leave it there, that congestion in and around the damaged site will begin to suffocate and kill otherwise perfectly healthy cells that were not involved in the initial trauma. So you want to get the swelling out. It's not bad. It's not good. It's just there because you failed to evacuate it. So how do you evacuate it? By activating the muscles in and around the damaged site. It's the only way to evacuate the waste. It won't evaporate. Abracadabra doesn't work. I already tried both. They don't work. So that's not going to work. You've got to move it out via the passive lymphatic system. And what's really odd about that to me, because of my age, when I grew up back in the late 50s, early 60s, every coach knew this. Every athlete that I ever grew up with knew this. The coaches would say, no matter what happened, if you got hurt, they'd say, don't sit still, keep moving it, walk it off. Everyone knew that. Don't sit, it'll tighten up, move. Well, we never asked why that worked. We just all knew it worked. Everyone knew it worked. But I never asked anybody, hey, why does that work when we move? I never heard the word lymphatic system in my whole life until maybe 25 years ago. So I went all that time, no one ever said why it worked, but I always knew walking it off worked. And you say, well, so wait a minute, walking it off, what's that? If you got hit with a basketball on the end of your finger and you just sat still and didn't move, your finger would swell, the joint would swell, the hand would get a little swelling to it, and you wouldn't be able to bend your fingers and they'd really hurt. And you say, well, so yeah, but what's the choice? What's the choice is get the swelling out.
Mm-hmm.
How do you get it out? You got to squeeze your hand. So what our coaches would have us do whenever that happened is the coach always had a rolled up sock in his little medical bag, and he would take the rolled up sock out and throw it to you, and you'd squeeze the sock.
Mm-hmm.
In effect, you were walking it off with your hand, because that's what you're doing. You're squeezing your hand, and it worked. And we never knew why it worked. We just knew that it worked. Well, now we know why it works, because walking it off is how you move waste to the passive lymphatic system.
Yeah, it makes sense.
That's what swelling. Swelling isn't your enemy. You don't want to take something that stops swelling. Like, for example, some people say, well, wrap it so that it'll prevent the swelling. It's like, wait, stop. You're going to do what? You're going to wrap it? You're going to compress the vessels that the waste and nourishment are trying to move through. Are you sure that's what you want to do? And I still have people today, all these years later that I've been doing this, explaining this to over 1 million people now, this why the Rice protocol is wrong. And now I'm at a spot where I have people will say to me, well, yeah, but if you compress it, it stops the swelling. Okay, stop and think for a second. You're going to compress it. You're going to wrap it, and you're going to compress it. Are you blocking only the in vessels or the in and the out? In other words, is there any way for you to compress and only compress the in vessels? The answer is no. It's not possible. You can't
So you're
compress
blocking
only
the inflammation.
the in.
You're blocking the stuff that you need.
You're blocking the good guys from getting in, and the bad guys from getting out.
Mm-hmm.
It's a completely false idea to compress. And then people say, well, yeah, but no, compressing works like with a tourniquet to prevent a bleed out when you rip your arm off. It has nothing to do with managing a swollen ankle. And they're like, oh, no, because it stops the fluid from getting in, so it limits swelling. First of all, you don't want to limit the fluid coming in. There's not too much coming. There's too little leaving. Okay? That's what's going on. You don't want to stop it from getting there, because that's what's mobilizing the repair and cleanup crew, the macrophage, the insulin-like growth factor. That's what's coming to the damaged site. The neutrophils, that's what's coming to the damaged site. That's when you're still, these stem cells in the area are not awakened and brought to the site to solve the problem. You have got to move it by a muscle activation.
Right. Yeah.
You're doing the exact opposite of what you should be doing.
Right. Yeah. My patients that are dealing with swelling, I always tell them go for a walk or ride a bike if walking is too painful, like a stationary bike. Because what a lot of people don't realize is that, as you said, the lymphatic system is passive. So the lymphatic system is very similar to the arterial system. The only difference is the arterial system has a pump, aka your heart. Lymphatic system does not. So it relies on contraction. And actually, your story about the sock reminded me of somebody who has a rotator cuff surgery, and they're putting a sling and they're giving that little ball at the end of the sling. Everyone thinks that's for strengthening your grip. It's not. It's to pump the hand, which basically pushes the lymphatic system out and gets the swelling out of the shoulder. So, yes. I mean, yeah, it makes perfect sense.
And by the way, that's a wonderful doc who's doing that. Mm-hmm. Okay, because he cannot understand that. I actually had a brain surgeon, and I know this sounds crazy, but I had a brain surgeon. I was at a lecture, and at the end of his lecture, I walked up to him and started talking to him. And he said to me, oh, I read your book. And I said, wait, stop. A brain surgeon read my book? I said, come on. He said, no, I read your book. He said, I got it. You're completely right. I've been trying to convince all my partners to stop icing their patients. That's less than 6 months ago that happened. Now, yeah. I look up their practice. There's some 30 doctors in their practice.
And he's probably the only one not doing it.
He's still trying to convince them to stop doing ice. And by the way, ice is wrong. Don't get me wrong. I'm not pro ice. I'm against the ice. But I'm not against it because I have an opinion. I'm against it because the reality of what happens when you do it. But not only is the ice wrong, but the rest is wrong, and the compression is wrong, and the elevation likely doesn't provide much of a benefit at all. If it does, if your goal is to limit the flow of the nourishment, the repair and cleanup crew to the damaged site, because it's like, we'll elevate it. Well, wait a minute, wouldn't that make it harder then for the repair and cleanup crew to get to the damaged site? Or are you sure you want to make it harder for that? Oh yeah, but it'll help with the swelling. No, it doesn't. It does not help with the swelling. It does not drain because you elevate it through the passive lymphatic system. It's not true. So I'm talking to this brain surgeon, and he's telling me about his conversations with his partners. And the same problem comes up every time. They all believe, since they've always done it, it must be right. Well, in fact, they haven't always done it. This is new. When I grew up in the 60s, no one ever told you to put ice on damaged tissue. Never. Never even heard of putting ice on damaged tissue when I grew up. Never. It's in 78 when Dr. Merkin made up the Rice Protocol in his sports medicine book. The book was called the Sports Medicine Book. When he did that, that's when this started. Now, for anybody who's listening and saying, well, wait a minute, who's this guy? I'm a reporter. I took the time to read all the literature and to organize it. I interviewed hundreds and hundreds of the most elite physical therapists, athletic trainers, and sports medicine docs in the country, at the Olympic training centers, at major military bases, with special ops, with pro teams. Over 100 professional athletic teams are on my list of the people that I deal with on a regular basis, semi-regular basis. A couple times a year I deal with all the head trainers and the rehab directors of over 100 pro teams. So I'm not talking about a small group of people here. Of everybody I know and everywhere that I go, people understand that the Rice Protocol is wrong. And they understand because I explain it. But then I tell you this, the doctor who made up the Rice Protocol, the Harvard educated doctor that made up the Rice Protocol, Dr. Gabe Merkin, after he read my book, publicly recanted, said I made this up in my 1978 sports medicine book. Research has clearly shown I was wrong. Don't do it. It delays healing, and then gives a specific reference to the fact that it causes additional damage. Now, not only did the guy who made up the Rice Protocol publicly recant, he then wrote the foreword to my book, to the second edition of my book.
And actually, that's a perfect segue, because I have it turned to that page right now. I was hoping to read the first paragraph aloud, if you don't mind.
Sure.
Okay, so this is from Dr. Gabe Merkin. This is the foreword in Gary's book, Ice, the Illusionary Treatment Option. Almost 4 years ago, I coined the term RICE, rest, ice, compression, elevation, as the treatment for the acute sports injuries. Subsequent research shows that rest and ice can actually delay recovery. Mild movement helps tissue to heal faster, and the application of cold suppresses the immune responses that start and hasten recovery. Icing does help suppress pain, but athletes are usually far more interested in returning as quickly as possible to the playing field. So today, Rice is not the preferred treatment for an acute athletic injury. So that's from the guy who came up with the Rice Protocol. Amazing.
Right. And now, not only that, by the way, and I respect Dr. Merkin a great deal, because first of all, most people who are world famous for their protocol would not admit at the end of their career that the thing that made them well known, made them an international figure, were wrong. So the great respect for the man to come back and say, look, it was wrong. But I go further. It isn't just rest and ice that are wrong. Compression is wrong. And compression arguably is the worst thing of all of the group. And here's the reason. Nearly nobody really rests. Okay. There are some people who might just lie on the couch for 3 weeks, but most people are going to start trying to move. They roll their ankle. They're going to try to start do stuff, and they're not going to just lie there and do nothing. So rest really isn't going to happen. Rest isn't really rest. In other words, almost no one really does the rest part of the Rice Protocol. Then there's the ice part. Well, the ice part, you know what? Most people put ice on a few times, realize it's really uncomfortable. It kind of stings and it's not fun and it doesn't really help. So they don't do it very often and they don't do it very long. So the ice part doesn't last to a big problem, although it is a problem because it delays healing, it increases swelling, and it causes additional damage, and it shuts off the signals that alert you to harmful movement. And you need movement to solve the problem. You need the signals to prevent you from doing harmful movement. So it does have a problem. But now think about compression. Here's one I actually witnessed. An athlete rolled their ankle on a Saturday. I was there in the training room when he came in. They had already x-rayed him, said it was a second or third degree sprain. They wrapped him up, I thought, pretty tight with the ace bandage, but that's not my job. So I'm not saying I'm an expert in how tight you should make it. It just looked pretty tight to me. Mm-hmm. So they wrapped him up and kind of, tapped him on the leg and said, look, ice as needed over the weekend. The doc's going to write you a script for some pain if you need to take it. And then come back Monday morning as soon as you're up and about, and we'll figure out what we're going to do. That sounded reasonable, right? That sounds pretty much what people would tell you, right?
Right.
I happened to still be there on Monday when he came back. He had not taken the ace bandage off the entire weekend.
Oh my God.
His toes were purple, and he had an indent with swelling above where the ace bandage was. And you go, that's insane. Nobody would do that. No, actually, I've asked hundreds of people. That's normal. That's common, that they'll leave the ace bandage on till they get back to whoever put it on them. They're not going to take it off. They don't know what to do. This person had that leg wrapped. In other words, compressing the very vessels that were trying to transport the nourishment and waste, compressing the vessels and preventing the natural flow. So what that ace bandage did over the weekend was literally trap the waste in and around the damaged site and prevented the natural flow of oxygen and supplies. You will find nowhere in the medical literature recommending that you should trap waste in and around the damaged site and prevent the natural flow of oxygen and supplies. That's what compression does. Now, when you add to that, making it cold, that will make it even worse. If you add to that, sit still, don't move, that'll make it even worse. And then if you tell me, in fact, to elevate it, well, now what you've done is, the very least, is you've made it harder for the nourishment to get to the damaged site. So the repair and cleanup crew trying to get to the damaged site, you made it harder because you're elevating it, and you had little advantage whatsoever in the return. Maybe that would enhance some venous return. I'm not confident that elevating your leg improves venous return. I'm not going to argue whether it does or not, but it has nothing to do with lymphatic flow.
Yeah, and it's crazy. And the RICE protocol is certainly what I learned. I graduated in 2013. It's ubiquitous. It's in every protocol I see still. And I don't know, how do we get away from this? Just education. I don't know how we flip the script on this.
Well, I have over 1 million people that heard my message. And I can tell you, with the pro teams that I work with, I don't want to mention names of teams. If they say it publicly, in my book, I do mention some quotes from pro trainers, but I don't say people's names without their permission, and I don't have permission, but I have emails from them thanking me. One guy said, "Thank you for hounding me for several years before I finally listened. I have to go back, and I have to go back, and I have to go back. And I got to break you from your old way." I met with a NBA head trainer, director of rehab and head trainer for an NBA team. I met with him on a Tuesday. I explained everything we're talking about now. He 100% agreed that it clearly would be wrong to trap the waste in and around the damaged site and prevent the natural flow of oxygen and supplies. Absolutely, 100% agreed with me. Thursday night, I'm watching a game on TV. His game. I'm watching his team. On the bench is this multi-million-dollar athlete with 2 bags of ice on his knees. I'm in my living room screaming at the TV. How is that even possible? I just, 48 hours ago, I explained, you 100% agreed. You got a multi-million-dollar athlete, you're putting ice on his knees. What are you doing?
Yep. That's crazy.
And by the way, if you were to ask someone, it's a simple question. If you were to ask someone, why are you putting that ice on? Oh, it prevents swelling. Really? Prevents swelling. Do you have any evidence that works? Oh, yeah, you put it on. No. Do you have any evidence that it works? In other words, when the tissue rewarms and the inflammatory response resumes, are you telling me that the swelling that your immune system was sending doesn't come? The fluid that's supposed to come, are you telling me it doesn't come because you made it cold? Well, I don't know. I've never checked that. Well, I can tell you that when the tissue rewarms, the inflammatory response resumes, and the fluid supposed to comes. Your immune system doesn't quit. And in fact, it's very possible that because you cause additional damage, and I'll explain that in a second, because you've often caused additional damage, there's more fluid coming, not less. And here's what happens. You ever hear of frostbite? You've heard of it, right?
Mm-hmm.
What's that? What's frostbite from? Make the tissue too cold, right?
Mm-hmm.
Okay. Why don't you put ice over a superficial nerve?
It's a good way to kill it.
Okay, so it kills muscle, it kills skin, and it kills nerve cells. We know that. You know it also kills muscle cells? Referenced in my book and all my papers, you'll see the paper from the journal, the index peer-reviewed journal, proving that it kills muscle cells. Now, residing in that area are the stem cells. Do you think it's a good idea to kill skin, muscle, and nerve cells if you're a stem cell residing in that area? This is crazy talk, what you're doing. But when you make it cold like that, you actually don't reduce swelling because the inflammatory response will resume when the tissue rewarms. So the fluid's going to come. But there's a high probability, if you made it really cold, that in fact, you're going to cause additional swelling. And if in fact you left it on too long and you caused a backflow from lymphatic vessels into the interstitial space, that fluid dropping back in, that waste coming back through the lymphatic system, back through the one-way valves that are destroyed from the cold, that fluid coming back in will be viewed as the body as in effect, splinter, as waste, and will set off an inflammatory response to come and take care of that. So you're going to get more swelling from that, more fluid from that. So you say, well, wait a minute, I'm causing additional damage. I'm increasing swelling. I'm delaying the healing process because you've slowed everything down. So you're clearly delaying the healing process. And you say, why would you do that? Well, you do it because you misunderstood. You're not there. There isn't. I was asked once to give a lecture, and they said, Gary, will you come and explain this to a major organization? And I said, sure. And they said, okay, well, here's the date. I said, well, I'll be there. No problem. I'm happy to do it. And I got a call back about 3 days later, and they said, oh, Gary, we got a little question. A few of the board members would like you to present both sides of the argument. I said, fine. What's the other side? And he said, what do you mean? I said, well, I'll be happy to present the other side. What is it? Well, the benefits. I said, what are the benefits? Tell them to me. I'll put them on a slide and I'll put it up for you. How's it help? Well, reduces swelling. It reduces swelling. How's that? And of course, there's never an answer because it doesn't.
Right.
And then I explain about all the things I just said about how it causes additional damage. Skin cells, nerve cells, muscle cells, probably the stem cells in the area. But now with all of that, he then said, well, are you willing to do that? And I said, I'd be willing to do it. I'll tell you what, different answer. Why don't you get that board member to present before me on the benefits, and I'll follow them. You know what they did?
Said, no, thank you.
They canceled my invitation.
Yeah.
Now, I got my invitation canceled because all I said was, there are no benefits, so why don't you go first and I'll go behind you? There aren't any benefits. Oh, but it controls pain. Wait, stop. Yes, it's true. If you make it cold, that will lessen the sensation of pain. At what cost? At what cost?
Yeah, delayed healing.
Are you willing to delay healing, cause additional damage, and increase swelling? and shut off the signals that alert you to harmful movement. And you need movement to solve the problem. You need the signals to prevent you from doing harmful movement. Or you're willing to trade that off. And anyway, if you do that to control the pain, I get it, and I agree it will work, but at what cost? But how about something different than that? Will the reason you have pain be gone when the cold wears off? And the answer is, of course not. You did nothing to change the environment. You've got to decongest the area in and around the damaged site. That's what you've got to do. And that's not going to do that. So you didn't change anything by making it not hurt temporarily. Now, with that said, are there ways to make it not hurt? Well, I'll ask you a crazy question. In your opinion, and if you don't answer quickly, I'll answer for you. So you can hide if you don't want to answer.
Okay.
What's the best way to control pain?
Decongest.
The absolute best way.
Pain-free movement to decongest the swelling.
Go further down the path. What's further down that path? And this is one of those odd answers. Are you ready?
Take
Heal.
pressure. Oh, okay.
Heal. When you're healed, your pain will go away. So the best way to control pain is not to make it cold, but to heal. Okay, well, what facilitates healing? You got to do two things. You got to decongest the area in and around the damaged site, and you got to rebuild the related vascular network. They're the two things you got to do, right? You got to decongest, you got to get all the stuff out of the way that doesn't belong there. And you got to rebuild the related vascular network. So how do you get the waste out of the area? How do you decongest the area? Obviously by, in effect, walking it off, by active recovery, by activating the muscles in and around the damaged site. That's how you'll evacuate the congestion. Then how do you rebuild the related vascular network? Well, it just so happens that rebuilding the related vascular network is contingent upon muscle activation in and around the damaged site that will increase the pressure inside the arterioles, the end of the arteries, and that will then cause sprouting angiogenesis, and you'll rebuild the related vascular network. And sometimes people say to me, well, what do you mean rebuild the related vascular network? Okay, think to yourself, you got an injury, and it's all black and blue. That black and blue and yellow and green, that's blood under the skin that has leaked, that has escaped from blood vessels. Okay, that's why it's there. It doesn't belong there. But the place it escaped from, that vascular network, that highway, has been compromised. It's broken. So you've got to rebuild the related vascular network. And until you rebuild it, it is virtually impossible for the tissue to mend. So you got to decongest the area in and around the damaged site, and you got to rebuild the related vascular network. You've got to do this. This isn't an option. You've got to do these two things. So how do you do that? Well, not by sitting still with a bag of ice wrapped tightly around it while sticking it up in the air. That ain't going to do it. You've got to walk it off. You've got to activate the muscles in and around the damaged site so that you can decongest and rebuild the related vascular network. It's really that simple. And what's hard to believe is that anybody who is in the business doesn't automatically know that. That should be like the first sentence of your education as a clinician. It should be the first sentence. What are you trying to do? I want to heal. Okay, how do you heal? Well, you need to decongest the area in and around the damaged site and rebuild the related vascular network. That's what you need to do. How could that not be like the first thing they taught you? It should be the first thing. Then everything you would do would build out from there. If it doesn't do one of those two things, think about where it fits in the puzzle then. Because if it doesn't do one of those two things, well, we should probably go and do squats with 400 pounds. That's probably not going to solve those two big issues. So don't do that. What does do those two things? What decongests the area in and around the damaged site and rebuilds the related vascular network? What does that?
Pain-free movement.
Well, do that then. That's what should be done. Here's a crazy thing for you to ask too, if you're dealing with any of your MDs. Mm-hmm. And I don't mean this in a negative way. I have hundreds of MDs who are 100% cooperative with me, but I've got a bunch along the way who have talked to me like they thought I was stupid. because they didn't like my questions because my questions did not go in line with what they were telling people to do. In other words, do the Rice protocol.
Mhm.
But I have a question. What is your actual goal? When I come into you, I've rolled my ankle. What's your goal? Or you're on the field and you run out to the player. What's your goal at that point? And I'm going to help. Your goal is to prevent further loss and regenerate that which has been destroyed. Right?
Right.
Could that be a good goal, right? To prevent further loss and regenerate that which has been destroyed.
Mhm.
Okay, what causes further loss? Well, congestion in and around the damaged site will suffocate and kill otherwise perfect healthy cells that were not involved in initial trauma. So you got to decongest the area, or you're going to suffocate and kill those cells. So that's further loss. You got to decongest the area. Okay, what else causes further loss? Well, disuse atrophy. What causes disuse atrophy? Well, disuse. So how do you prevent disuse atrophy? Well, by using. And what happens is when you activate the muscles, when you stress the muscles produce and release what's called PGC alpha 1. And that blocks, or I like to say blocks or retards, but let's just say blocks because that's what the literature says. But I like blocks makes it sound like it blocks 100%. I'm not sure you block 100%, but it says blocks in the literature. I say blocks or retards just because I like to throw in a little bit of, you're going to lose something here.
Right.
But the disuse atrophy can be blocked or retarded by simply activating the muscles in and around the damaged site. What else causes further loss? Well, loss of functional range. Well, what causes loss of functional range? Basically adhesions or faulty scarring, and then your range of motion will be compromised. It won't be as good as it was before. And then you may have the pleasure of going into the physical therapist who then is going to break those adhesions, which is misery times 10. It's one of the worst things I've ever watched when I watched people have adhesions broken post-op in a shoulder or in a knee. It's terrible. It's terrible theater. But how can you avoid that? Like what would prevent that kind of a problem? Those adhesions, that faulty scarring, that loss of functional range from the adhesion faulty scarring. Well, if you reorganize to repair tissue, that will likely prevent the faulty scarring, the adhesions. And you say, so, well, what does that? Well, if you activate the muscles in and around the damaged site, you will in fact reorganize, repair tissue. That's what loading does. That's why the steps are inflammation, repair, and then remodel. Remodeling is simply getting that tissue to be functional. Okay, so that's the three big things that happen in loss. Well, so remember, our goal is to prevent further loss and then to regenerate that which has been destroyed. Okay, so how do you regenerate that which has been destroyed? What's the actual process? What do you have to do? Well, let me think. We'll regenerate the tissue. You probably have to rebuild the related vascular network in and around the damaged site. Okay, so what rebuilds the related vascular network in and around the damaged site? It just so happens the same stress that decongests the area in and around the damaged site, the same stress that prevents and retards the disuse atrophy, the same stress loading of the tissue that rebuilds, that reorganizes and repair tissue, the same stress that rebuilds the related vascular network, the same stress does all four things. But there's one more thing. When you're inactive, your myostatin levels elevate. Myostatin blocks or inhibits is a better word. Blocks is not a good word. Inhibits muscle regeneration. So if you don't remember what myostatin is, you may have got out of school just at the wrong time to have learned about myostatin. But if you remember when you were younger, there was something in the news. His name was Boy Hercules. And it was this young 10-year-old boy with giant muscles. Do you remember Boy Hercules?
I don't know.
Okay, if you Google, you might not be old enough. It may have missed you because it's in the mid-90s. But if you Google Boy Hercules, myostatin, you'll see that this young boy didn't have myostatin. And his muscles grew to be enormously big, amazing. And he looked like Boy Hercules. It looks unbelievable. Well, it just so happens that there are other animals on the planet who also have myostatin, and they're very, very muscular. And you can see it. It's a lot of information about it. It was discovered, I think, in 95 or 97. And what myostatin does is inhibits muscle regeneration. So what that is how we regulate so our muscles don't get too big. And how it works is this. The myostatin, as it elevates, inhibits muscle regeneration. When the myostatin lowers, the muscle regeneration is normalized. Okay, so how does that matter to all of this? You're hurt. You're trying to regenerate in and around the damaged site. You wouldn't want to inhibit muscle regeneration. So you need to lower the myostatin levels. Well, how do you do that? Well, with muscle activation. The same loading that decongest the area in and around the damaged site, that prevents and retards the disuse atrophy, that reorganizes the repaired tissue, that rebuilds the related vascular network, will also lower the myostatin levels. And it's just incredible how this process is all contingent upon walking it off.
Yep.
The whole thing
That's
set
simple.
up. And I had a doctor say to me, as you just said that, doctor said to me, and I was giving a lecture to about 100 docs. And one of the docs said, "You make this sound too simple, Gary." And I looked at him and I said, "Doc, it had to be simple. If it wasn't simple, we'd all be dead. A stubbed toe could kill us."
Yeah, it's evolution.
It had to be simple. And it had to be one stimulus. Imagine if there was a stimulus for decongesting the area in and around the damaged site. Another stimulus to prevent or retard disuse atrophy. Another stimulus to reorganize to repair tissue. Another stimulus to rebuild the related vascular network. Another stimulus to lower myostatin. Imagine there's 5 stimuluses that are necessary for we would never survive. How would we do it? It had to be something simple, like simply loading the tissue. That's why walking it off worked since the beginning of time, by the way. We've always walked it off. We've always healed by movement, not by stillness. On my website, GaryReinl.com, there's a paper called Stillness is the Enemy. You could even Google Stillness is the Enemy Reinl, it'll pop up. In that paper, I have all the references to tell you why you don't ever want to be still post-trauma. It's a bad idea. You said, well, what about if it's if it's really, really hurt, move what you can. I have a simple rule: use your brain, never cause pain. So if you tell me your ankle hurts so bad that you can't move it, flex your calves and wiggle your toes. Do something. The sooner you decongest the area in and around the damaged site and rebuild the related vascular network, the sooner you're going to feel better.
Also to mention too, that stillness, they used to put people on bed rest, and then they just found that people were dying because it's causing blood clots too. So we're made to move. We're just not good at being still.
And we're made to heal. The human body is designed to self-repair, not self-destruct, but it's contingent upon movement. So I remember back 1974, somewhere around there, 73. And I had the 7th Nautilus gym in the world back then. So Nautilus was a kind of weightlifting equipment that was very popular back in the day. In the early days of sports medicine, if you had Nautilus, you had the best. Well, I had the 7th Nautilus gym in the world, and my orthopedic surgeons in town would send me the athletes post-op, mostly knees, and they would send me those athletes post-op to help them bend their leg again. They said, "What do you mean bend their leg again?" Well, what they used to do is they cast them for 6 to 8 weeks post-op, and they'd come to you with a straight leg.
Yep.
And we had to try to get their leg to bend. I mean, it took weeks and weeks to get their leg to bend again, so their foot could come up towards their butt. And you think, why would they do that? Well, that's the way it was done. Today, post-op, what do they have you doing?
They have you moving as fast as possible.
Like amazingly fast.
Yeah.
Nobody.
Like hip replacement, you're walking that day.
I have never heard of anybody in a straight leg cast for 8 weeks in decades, but that's the way it was done. And now it's not done that way anymore. Right. We understand that movement solves the problem. The irony to me is the caveman knew that walking it off was the right answer. Then all the geniuses came along and completely fouled up the healing process.
Yeah, it's now it's hubris. It's like that we think we can outsmart evolution.
Yeah, well, guess what? We can't. Guess what? We can't. And so there you are. You're at this spot in time where we realize that The human body is designed to self-repair, not self-destruct. And you say, so what's the key? The key is movement. But I have a rule: use your brain, never cause pain. So healing, recovery, isn't a training technique. It's a recovery technique. There shouldn't be pain involved in recovery. You should be able to do things that don't hurt. Well, how I like to say it, to be clearer, was if what you're doing increases your level of discomfort, it's probably wrong. Now, granted, sometimes if you've been mismanaged, you're going to have to break adhesions on people, and that's going to hurt. Okay, that's a different thing. That's because you were mismanaged up front, not because the body didn't heal correctly. So that's the different thing. If you got in right away and you start solving the problem immediately, you would find out on the other end that things are much easier to deal with. And I'll give you a real life story, and I'd be willing to give you this person's name and team that they work with. I can't do it on the air because that's not right. Mm-hmm. But this is an actual story where I have all of the emails and related correspondence, and he has agreed to answer questions if anybody wants to talk to him. Okay. I got an email from a head trainer, 25 years at the top of the heap. So pro team, head trainer, director of rehab, is an ATC, DPT, a CSCS guy. So he's got all the credentials. And I got an email from him that one of his athletes had a longitudinal quad tear. And with that, he measured the blood in the quad with ultrasound. They then did what I said to do with muscle activation for about 6.5 hours. The following day, they measured the blood in the quad with ultrasound. His words, gone. G-O-N-E, gone. Gone.
Six hours?
About 6.5 hours they went.
Oh, my God.
And by the way, I have guys like, someone that Kelly Starrett, the supple leopard DPT. Mm-hmm. Kelly just got a new knee, and he was on for 15 to 18 hours a day for the whole first 30 days. So he never let it swell. He never had disuse atrophy. He controlled all the reorganization and repair tissue, and he rebuilt the related vascular network, and he had no myostatin issues. Kelly was on 15 to 18 hours a day. You can go online, put in Kelly Starrett new knee, and you can hear it, you can see, because he documented the whole thing. But so the athlete was on for about 6.5 hours. So the word was gone, period. New sentence: we turned a 4 to 6 week injury into running in 3 days and playing in the world championships in 10. Now, you might be tempted to think that's not possible. Hold on. I just told you that this person is more than competent. As a DPT, ATC, CSCS, this person is very competent. 25 years at the top of the heap. So he's been a head trainer for over 25 years now. Now, with that, and of a major sports franchise, with that, he then said to me, Gary, I was shocked how doing what you said to do sped things up. I said it didn't. He said, no, Gary, I've been doing this for 25 years. I'm telling you, it takes 4 to 6 weeks. I said, no, mismanaged. Mismanaged, it takes 4 to 6 weeks. Now watch why. If you did the RICE protocol following that trauma, the following day, you'd have very significant swelling, which would be suffocating and killing otherwise perfect healthy cells who were not involved in the initial trauma. There would be significant congestion in and around the damaged site, probably down below the kneecap at that point. Nearly for certain, they'd be on crutches. Remember, if you're following the RICE protocol, you'd be trapping the waste in and around the damaged site and preventing the natural flow of oxygen supplies. So you'd be making a complete mess of the situation. Now they'd be on crutches. And to be fair, let's just say 7 to 10 days, they'd be hopping around on crutches. Maybe it's 6, maybe it's 11, whatever. 7 to 10 days, they're on crutches. Now, with that, there'd be significant disuse atrophy. And the reason for that is because you wouldn't be using the area because the knee wouldn't even bend anymore. Your toes are probably hurt at that point. Now, on top of that, you would not be reorganizing any repaired tissue. Remember, you've got a longitudinal quad tear. So you would not be reorganizing repaired tissue, so you're likely to develop some Foley scarring. Now, on top of that, you clearly would not be doing much to rebuild the related vascular network because you aren't doing anything to facilitate the tissue, the vascular regeneration. So there'd be very little going on there. Now, in parenthesis over here, your immune system is trying to rebuild the related vascular network on its own. That's kind of innately occurring. But no doubt, if you would have stress, you could stimulate some sprouting angiogenesis. So you've done nothing to improve the development, the rebuilding of the related vascular network. And clearly your myostatin levels are elevated because you're not doing anything. So that's why it takes 4 to 6 weeks, because you mismanaged it. We now know how long it actually takes. 3 days running, 10 days playing in the World Championships. That's how long it really takes. And how many examples do I have like that? Through my network of over 100 pro teams, over 500 collegiate teams, and the military that I work with, I have hundreds and hundreds and hundreds of examples like that. Everything from broken fingers to owner gel, up and down, back and forth. In fact, I have one of my most amazing ones was I got a call from a trainer from a major university in the Southeast. And he said, Gary, we got a problem. And I said, what? He said, we got to rewrite the protocols post-knee. And I went, why? I mean, I have no idea what this call is about. And he said, well, we got a problem because our protocol now calls for when you have blank extension, blank flexion, then you can begin to weight bear. He said, we got that in 5 days now. And they're not ready to weight bear. I said, well, that's a good problem, right? He said, oh, yeah, but we got to rewrite the protocols because we got a problem here because they're not ready. Well, think about that. What if you didn't have the congestion in and around the damage site 5 days post-op? What if it wasn't there? And then what if you didn't have systemic tissue atrophy? And then what if you didn't have faulty scarring? Because when you put the ice on, it increases the collagen buildup in the area, and that screws up the scarring process to begin with. But just the fact that you didn't reorganize repair tissue because you didn't load the tissue. So you don't have that. You have the rebuilding of the related vascular network because you're doing something immediately. Like I'm talking in the first hour or two post-op, you begin to rebuild that related vascular network. And clearly the myostatin levels have been lowered because you're activating the muscle. So he had to rewrite his protocols post-knee op.
Yeah, that's amazing. I mean, when are we going to rewrite all the protocols? Because this really flips everything on its head.
Everyone I know has already flipped them. I have pictures I cannot send to you, but when I meet you in person, I will show you. I have pictures of a Major League Baseball pitcher, post-op ulnar collateral ligament reconstruction, second one on this player. His hand is swollen like it looks like he has a glove on. Fingers are touching, they're spread apart and everything's touching. It's so swollen. 72 hours later, I have another picture. 100% totally clean hand, no swelling whatsoever. Now, the head trainer, director of rehab for the team, writes in the email, Gary, I thought you'd like to see these pictures. Then he writes about the doctor did the surgery, doesn't say the player's name, but writes about the doctor who did the surgery, and that this is a picture post-op, and then another picture 72 hours later. Now, they had him on somewhere between 6 to 8 hours a day for those couple of days on our muscle activation device. So now the hand's completely clean, and you go, so how's that matter? Well, normally that's a 10-day problem, maybe a 14-day problem with that much swelling. I don't have any of the downstream problems that come with all that congestion because I don't have the suffocating killing of otherwise perforated cells. We're not involved in initial trauma. I don't have the diffuse atrophy. I don't have the faulty scarring. I don't have the lack of rebuilding the related vascular network. And I don't have the elevated myostatin. So I don't have any of that stuff. That player was weeks ahead of projected recovery. Not because we sped things up, but because we normalized the rate of recovery by eliminating the obstacles. So just real quick, swing back to that athlete I told you with the longitudinal quad tear. Mm-hmm. So now we've got them, they're playing in the World Championships. Why does it matter? Because some people might say, oh, what's the difference? 10 days, 4 to 6 weeks. They got better both ways. Hold on. this particular athlete scored a goal in the semifinals that took them to the finals. That this athlete played in the finals. They won the world championships. That athlete, with their longitudinal quad tear only 10 days prior, but at that point, probably 12 days because, they played multiple games, but they played in the world championships. Well, no, I guess I got to watch how he worded that. Whatever, we're within 2 weeks, 10 to 14 days there. That athlete then stood on the stage as the national anthem was playing in the background, and a gold medal went around their neck. None of that happens if they had been mismanaged.
Yeah.
So you might say, hey, in either case, they got better, right? Well, hold on. In either case, they got better. But the one way, they may not even have traveled with the team to the world championships. And the other, they stood on a stage while the national anthem was playing and a gold medal was placed around their neck. Now, why does that matter? For the rest of their life, that athlete tells that story, not the one about how they didn't go.
Yeah. No, that's super powerful. And we're about an hour in. I want to be respectful of your time, but I can only assume a lot of this had to do with the Mark Pro, which we haven't even touched on yet. So I'm hoping I can get you back on for a second time where we can dive into deep on the Mark Pro and all its uses. Would you be willing to do that?
I'd be happy to do it. And so, there some of the things we've talked about are done by Mark Pro. And then some are done by a prescription version of the electrical stimulation called H-Wave. And the reason that they're different is because when you are hurt, Mark Pro is an over-the-counter product to facilitate and enhance recovery of healthy tissue. So the difference is the attending physician needs to write an order to get an H-Wave for like that longitudinal quad tear. That was H-Wave. That post-op hand, that was H-Wave. So it just depends on how serious the problem is. My rule is, my general rule is this: if you're tired and sore, it's Mark Pro. If your injury is potentially career-altering or ending, that's definitely H-Wave. So it just works like that. And remember, I'm working in the professional sports world is 90% of my business. So I'm over into professional sports world where that's work comp. And so I'm following a process that says never should a company, say like Mark Pro, be directing care without a prescription. Well, it's not a prescription product, so it doesn't qualify in that category.
Yep.
Whereas H-Wave, that does qualify, but it requires a prescription.
I see. Yeah. So we'll definitely dive deep into that. I want to know all the physiology. I mean, pretty much going to be the same physiology, I assume. And we'll get into some depth on that. But Gary, I really want to thank you for coming on this podcast. This has been super enlightening. And I've stopped telling people to ice a long time ago. I'm going to tell them to stop ricing too.
Stop the ricing. Rice is wrong.
Yep. Pain-free movement. That's the key.
And the great news is, all you have to do is do it one time, and it's. Or what's even better than that? If you just ask the correct question up front, what are you trying to do? I'm trying to prevent further loss and regenerate that which has been destroyed. Okay, if whatever you're going to do doesn't do one of those two things, put it over in the gray column for a little bit and hold it over there. Do what's going to prevent further loss and regenerate that which has been destroyed. Do those things first, and you'll find that movement is how those two things are accomplished.
So you heard it, folks. That's it. Movement is the key. Movement is medicine. So Gary, thanks again for coming on the podcast. We'll chat soon about getting you on a second time.
Looking forward to it. By the way, I used to live in Naples.
Yes, I did notice your area code when I called you. Where in Naples was it again? I
was right off Airport Pulling on Orange Blossom in a little development called The Crossings.
Yep.
Wonderful place to live. I used to walk down to the beach. Like 2.5 miles to the beach, but it was a great walk right down It wasn't airport pulling. I don't remember the name of the road, but it went right to the Ritz. I remember that. You could walk right down the street, right to the Ritz.
Yep. Well, I'm not sure the last time you've been here, but there's been a ton of development. So Naples is blossoming.
Well, it's been about 15 years. So
Yeah. Well, we'll have to get you down here.
good
So-
stuff. Anytime you tell me I need to come. I'm actually coming to Orlando in December for a Major League Baseball meeting. So
Oh, really? All right.
I'll be in Florida.
All right. Well, we'll have to connect.
Good stuff. Look forward to it.
All right, Gary. Thank you again. Take care.
My pleasure. Bye.
Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get results in 2 to 5 days, no physician referral needed. Use the code DPT20 for 20% off. Go to letsgetchecked.com and use the code DPT20. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.